Hello viewers, this is Dr. Avinash Rao, hand and reconstructive microsurgeon. I am associated with TX hospitals right now. So we are going to talk about hand surgery today. What is hand surgery and what does this specialty includes? So hand surgery is a specialty wherein the surgeon deals with all the problems related to hand, wrist, elbow, peripheral nerve surgery and reconstructive microsurgery. So hand surgery, what are the conditions which come under hand surgery? So the conditions which come under hand surgery are starting with the nail bed injuries to the bony injuries, tendon injuries, nerve injuries, compressive neuropathies, congenital anomalies, rheumatoid hand, and many other pathologies which are affecting the upper limb. So hand surgery is a specialty wherein the surgeon deals with all the problems related to hand and upper extremity. Is hand surgery a separate specialty? Yes, it is a separate specialty in countries like UK, USA, Finland, Sweden, Switzerland, and many other countries, many other developed countries. It is a separate specialty. In India, it is coming up in a big way. Many of the young hand surgeons are coming up with specialized degrees, and they are exclusively trained in hand and upper limb surgery. So, hand surgeons ante evaru? So, plastic surgeons, orthopedic surgeons, and general surgeons, everyone operate hand. But hand surgeons who are getting exclusively trained in hand surgery are coming up now. They deal with all the problems related to hand and upper extremity. So when you should consult a hand surgeon, whenever you have any problem related to hand and upper limb, like hand, wrist, and elbow, you should consult a hand surgeon. So what are the conditions we deal with, and what are the conditions we operate usually? We usually deal with nail bed injuries, fingertip injuries, flexor tendon, extensor tendon injuries, bony injuries involving the phalanges, metacarpals, and all the surgeries around the wrist. That includes scaphoid fractures, lunate injuries, perilunate injuries, TFCC injuries, distal radius fractures, forearm rotational abnormalities, and we also deal with complex elbow injuries like terrible triad of elbow, ligament instabilities, elbow instabilities, radial head dislocations, radial head we do radial head replacements, we do complex elbow procedures like elbow arthrolysis. We also deal with burns of the upper limb, contracture releases, post-burn reconstruction of upper limb. We also deal with nerve injuries like radial nerve, ulnar nerve, median nerve. We do tendon transfers for all these procedures. We correct wrist drop, claw hand deformities. We correct mallet deformities, Botnia deformities, which are most commonly seen in extensor tendon injuries. We also deal with rheumatoid hand, and we correct Z deformity of the thumb. We deal with wrist problems like carpal instabilities, DRUJ injuries, scaphoid fractures and non-unions, perilunate injuries, and all the carpal related problems. We also deal with elbow injuries like complex elbow injuries like terrible triad injuries, ligament instabilities, radial head injuries. We also deal with pediatric elbow like supracondylar fractures, non-unions and malunions. We also treat upper limb burns, tendon injuries and tendinopathies, and nerve injuries and compressive neuropathies, and we also do microsurgery. So coming to the tendon injuries, we operate all the zones of extensor and flexor tendon injuries. We also deal with tendinopathies like degervant stenosynovitis, trigger fingers, trigger thumb, and lateral epicondylitis, insertional syndrome. So we also deal with compressive neuropathies like carpal tunnel syndrome, cubital tunnel syndrome, Gans canal syndrome, Wattenberg syndrome, and so on and so forth. Hand surgery is an upcoming specialty. Previously, most of the patients with hand injuries used to be referred to be a plastic surgeon or an orthopedic surgeon or a general surgeon. But hand surgeons, hand injuries and hand pathologies require a continuous follow and constant monitoring of the outcome. So consulting a hand surgeon will improve the results definitely. Most of the people will be going to plastic surgeons, orthopedic surgeons or general surgeons without knowing that hand surgery is a separate specialty. The pathologies related to hand are very complex and which needs a regular follow-up and constant physiotherapy and monitoring to get good outcome. So consulting a hand surgeon and a proper hand physiotherapist and occupational therapist will improve the results definitely in hand and upper extremity problems. Thank you.